Margaret went to her doctor feeling completely fine. She left with a referral, then another, then a procedure. 18 months later, she's on 2 medications, has had 1 surgery, and her quality of life is measurably worse than the day she walked in. Her doctors made no mistakes. Every decision followed the guidelines perfectly. So how did a routine checkup make a healthy woman's life worse? That question has an answer, and it starts with something called the ruler. Before we follow what happened to Margaret, we need to name something. There's a belief most of us carry into every medical appointment. If something's wrong, I'll feel it, and if I don't feel it, I'm fine. This belief isn't stupid. For most of human history, it was exactly right. Pain, fatigue, fever, your body is an extraordinary early warning system. But there's a specific category of finding, increasingly common after 50, where this belief breaks down completely. Not because your body stops working, because the tools being used to measure it were never designed for a body like yours. Which brings us back to Margaret, and the moment her cascades started.
It started with a blood panel. Routine. She'd had dozens. One number came back slightly outside the reference range, the column marked normal. Not dramatically outside, just flagged. Her doctor, following protocol, referred her for a follow-up test. The follow-up found something, small, probably benign, but worth monitoring. Monitoring led to another scan. The scan found something else, different, unrelated, also small. That finding triggered its own referral. Margaret wasn't scared at this point. She was being thorough. She was doing everything right. Each step made complete sense. A competent doctor, a diligent patient, a system working exactly as designed. But here's what nobody told Margaret. The number that started this entire cascade, the flagged result on her blood panel, was flagged by a ruler. And that ruler wasn't built for her.
Every lab result you've ever received has a normal column. That range, the boundary between flagged and fine, was established using a reference population, a group of people whose results defined what normal looks like. Here's the problem. Most of those reference populations were built from hospital patients, people who were sick, people in studies, mostly younger, mostly in some kind of medical crisis. That's the population that defined your normal range. So when your 52-year-old body produces a result that is completely typical for a healthy, functioning 52-year-old, the ruler compares it to data from a sick 30-year-old and flags it. Not because something's wrong, because the ruler doesn't know who you are. This is the trap. And it's almost perfectly invisible because the flag looks the same whether it means something or not. Here's why this problem targets people over 50 specifically. A body that has been running for 5 decades has accumulated things. Nodules, cysts, calcifications, slowly changing cells, minor hormonal shifts. None of these are necessarily problems. They're biological residue, the physical record of 50 years of living, healing, adapting. But every single one will appear on a scan. Every one will trigger the ruler. Every one will require a response. And here's the part that sounds almost cruel. The healthier you've been, the more your body has accumulated because you've survived long enough to collect it. A 55-year-old who has been active, non-smoking, well-nourished will light up a full-body scan far more than a 35-year-old with half their life behind them. The ruler sees this accumulation and calls it findings. The medical system sees findings and asks, what do we do about this? Nobody stops to ask, is this ruler measuring the right thing?
By month 6, Margaret was being recommended a procedure. The risks were explained carefully. They were small. She signed the consent form. The procedure went exactly as planned. No complications in the room. Her surgeon was skilled. The team was professional. 2 weeks later, a side effect emerged. Not rare, listed in the literature. Manageable, but real.
Now Margaret was treating the side effect. And the original finding, the one that started this chain, was later reclassified. Probably not significant. Watchful waiting would have been reasonable. But watchful waiting wasn't what the ruler recommended. The ruler saw a flag. The system followed its own logic. Margaret followed the system. Nobody did anything wrong, and yet here she was, worse than when she started. This is where the story gets specific and strange. In 1994, the World Health Organization convened a committee to define osteoporosis, low bone density. The committee needed a reference population. They chose young adult women at peak bone mass. Then they drew a line. Anyone whose bone density fell more than 2.5 standard deviations below that young adult peak would be classified as having osteoporosis. Overnight, not because anyone's bones changed, not because new research emerged, 30% of all postmenopausal women became diagnosable with a medical condition. The bones didn't change, the ruler changed. And with a new diagnosis came new treatment guidelines, new medications, new monitoring, new procedures. The ruler created a condition that created a cascade for millions of women who had walked into appointments feeling fine. Margaret's ruler worked the same way. Different number, different test, same mechanism. The question that should be landing right now, how many times has a ruler been drawn this way and nobody told you? Here's where it gets personal. There are 3 numbers most people over 50 get flagged for that follow the same pattern: cholesterol, PSA in men, thyroid markers in women. All 3 have reference ranges built decades ago from populations that don't look like you. Cholesterol guidelines have been revised 6 times in 30 years, each revision expanding the pool of people classified as needing treatment. In the 1980s, a total cholesterol over 240 was concerning. By 2013, the guidelines suggested considering treatment for anyone whose calculated 10-year risk exceeded 7.5%, a formula that essentially made age itself a risk factor. Not because the science changed dramatically, because the committees kept moving the line. PSA testing for prostate cancer has such a high false positive rate that the U.S. Preventative Services Task Force spent years recommending against routine screening. But millions of men still get tested annually, and when PSA is elevated, which can happen from aging, inflammation, even riding a bike, the cascade has momentum. Biopsy, results, monitoring, treatment decisions for cancers that, in many cases, would never have caused problems. 3 common tests, same ruler problem. And if you're over 50, you've probably been measured by at least one of them. The trap isn't the test, it's not knowing the ruler wasn't built for you. And once the cascade starts, momentum takes over. Each flagged result justifies the next test. Each finding requires documentation. Each documented finding creates liability if not acted upon. The system has its own logic, and that logic doesn't pause to ask whether the original flag was meaningful for your specific body. When Margaret finally learned about the ruler, something shifted. Not medically, her complications were real and would take time to resolve, but she stopped being confused. She had spent 18 months asking, what did I do wrong? What did my doctor miss? Why did this happen? The answer was none of the above. She walked into a system designed for sick people as a healthy person, and the system did exactly what it was designed to do. That understanding didn't undo anything, but it changed how she would walk into every appointment from now on. She had a new question to ask, one that changes everything. Here's what Margaret knows that now you know too. The next time a result comes back flagged, yours or someone you love, you're allowed to pause. Before any cascade starts, you can ask your doctor 3 things. First, what was this reference range based on? What population was used? Second, were those people like me, my age, my health status, my demographics? Third,
what are the actual risks if we monitor this for 6 months instead of acting on it today? These aren't confrontational questions, they're clarifying questions. Most good doctors will welcome them because they change the conversation from "the computer flagged this" to "let's figure out if this matters for you specifically." That's not refusing medicine, that's asking for the context the system often forgets to provide. Sometimes the flag is real. Sometimes the treatment is necessary. Sometimes the ruler was built exactly for you and the intervention will save your life. But sometimes, more often than most people realize, the flag is an artifact of a ruler that doesn't fit, and knowing the difference turns you from someone who walks into a trap willingly into someone who walks into a medical appointment as an informed participant. Margaret wishes she'd known this 18 months ago. She wishes someone had told her the ruler existed. That one conversation might have changed her entire trajectory. That's why this channel exists, not to tell you to ignore medical advice, but to give you the context the system doesn't always provide. So the next time you're standing at the edge of a cascade, you'll see it before you step in. Subscribe because your body is running on timelines and being measured by rulers you didn't know existed, and understanding them changes everything about how you navigate midlife.